Welcome everyone to a brand new webinar with Euphoria Health. We are here to announce our brand new treatment, UltraClear. This is our virtual launch event with my favorite duo, Theresa and Brittany. We are super excited because Euphoria Health is the first and only practice in Nebraska to bring UltraClear to patients. If you've been curious about what's next in laser treatments or skin rejuvenation, you'll get an inside look today. We'll explain what this laser can do, why it stands out from other options, and why we're so thrilled to offer it right here in our state. We do also have a promotion and a promotion for you today, so make sure you stay tuned until the end of the webinar and I'll explain how that works. Before we get started, let me introduce you to our wonderful speakers. Theresa Sain is a medical esthetician and co-founder of Euphoria Health. Alongside her, we have Brittany Reeg, one of our skilled physician associates who has specialized in advanced aesthetic treatments for over 5 years. Together, they combine medical expertise and personalized care to help their patients achieve healthy, radiant, and confident skin. Theresa and Brittany, the floor is yours.
Awesome. Welcome.
Hello, everyone. Thank you so much for joining us this evening. I know everyone is busy, so we appreciate your time. Like Holly said, I'm Brittany. I'm one of the PAs here at Euphoria Health. We are so excited to have this UltraClear laser here with us. In the short time we have had it, we've seen some amazing things. So it's really impressive, and we can't wait to share more with you. During this webinar, we're going to kind of go over some of the technology, behind the laser. We'll show you some before and afters. We'll let you know if you're a good candidate or who's a good candidate, what we're looking for. Just go kind of deep into that. All of this info we typically cover during our consults. And so, you kind of get like a free consult here with this, but then we also do encourage people to come in as well for a free consult, just so that we can personalize a treatment just for you, and kind of go over pricing and what your treatment will exactly look like. So if you decide that this is something that you would like to pursue, then by all means, please reach out and schedule a consult with us. We would be more than happy to talk more about it with you individually. So let's get started.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
So you might wonder if you're a candidate. Really, anybody is a candidate for UltraClear. If you have uneven tone and texture, fine lines and wrinkles, acne and surgical scars, pigmentation concerns, sun damage and age spots, or just overall skin rejuvenation, it's a great option. And like I said, it's for every skin type.
So yeah, in the past, or just with other lasers out there, we have to be super careful with people of darker skin tones, just because we can make it worse. We could cause either more pigmentation or less pigmentation. And so this is the absolute bonus with UltraClear, is we can treat everyone. So okay, so why are patients choosing UltraClear? Number one, so with the way the technology is with UltraClear, you oftentimes hear like cold fiber or cool pulse technology. So basically what this means is the thermal energy that you're delivering to the skin is just controlled. So this causes, less downtime, less pain during treatments compared to other lasers out there, other ablative lasers, I would add, like CO2 or whatever, for example. So it kind of changes the game with that. And that's where we get the comfort without compromise. All in one solution, like Theresa said, it covers all those skin, issues or problems that someone may have. And so it's a great option to do whatever your main concern is with your skin.
And you can do it anywhere on the body. It does not have to be your face or your neck. It can be anywhere on your body. It does take a little bit longer on the body to heal, but you still get really wonderful results.
Yeah. And then, so it's also pretty quick and convenient. We'll touch on the different modalities within the laser. So depending on which one you get, but for the most part, all of them are very quick and convenient. And like Theresa said, it's very versatile. So it's not just a face and neck. That's a very, those are the two most common spots, I would say. But you can do so many different areas, hands, chest, surgical scars on the body, whatever. So. Okay, so a lot of times too, you'll hear us talk about the skin tone or skin type, whatever. This scale is what we look at when we determine what skin tone you have. So this is called the Fitzpatrick scale. So type 1 to type 6, typically what we're looking at. And like I said before, the type 4, 5, 6, we've had to be careful with in the past, just because we can cause, even worse pigmentation, can cause scarring. So great news with this, we can treat all 6 of them. When we get to some of those higher Fitzpatricks, we do have to be a little bit more careful and kind of tailor the treatment more towards you. We can change some of the settings, but it is still doable for all. So. Okay, so like I said, there's multiple modes within UltraClear laser. So it comes with 6 modes. On the left there, you can see those listed out. So they're kind of broken down into 3 levels: superficial, moderate, and then advanced. So with the superficial, we're talking about a 3D miracle treatment. This is going to be the least intense, least invasive, least downtime associated with it. This is a quick office procedure, typically, 20 minutes in and out. We do not numb, so it's very tolerable pain-wise. You'll leave here, slightly pink red, maybe have that for a few hours to a day, and can maybe have some sloughing of the skin, so just some flaky peeling, but that's as far as downtime goes. So that one is very simple, very quick. It's just a great overall refresh of the skin. So like I said, it kind of sloughs off that outer layer, just leaves you nice and bright and rejuvenated.
And then also we generally suggest that you can just get one treatment. You can get as many as you want, but we do suggest a series of 3 treatments about a month apart. So yeah, for the 3D miracle. Yeah,
this is one of the only that we do kind of recommend a series of, just because they do add on to each other. And I mean, it's a great little refresh once a month. So who doesn't love that? Next, so like that moderate, we move down, we're going a little bit deeper in the skin now. So this is where we get into our clear, which clear mode is going to be more for pigmentation. And then ultra is going to be more for fine lines, wrinkles. And then ultra clear is a combo of those 2. So separate mode entirely, but it just combines the clear and ultra. So you get double the benefit. This group of treatments are going to see a little bit more downtime. So I would say, 3 to 5 to 7, even. You're going to be a little bit red. You could have the markings from the laser on your face for a few days, could be a little swollen. So just a little bit more downtime with that one. And something to keep in mind, when we say downtime, we really just mean social downtime. So when someone looks at you, they're going to notice that you had something done, but you're not going to be uncomfortable in pain for a period of days. You can go about, living your life however you would like to, but it will just be noticeable that you had a little something done. So that's what we say by downtime. And then in the bottom row, so we have the advanced. This is where we get our laser coring. So this is going to be the most intense treatment that is offered with UltraClear. So this is going to go even a little bit deeper into the dermis, and we're going to really get collagen remodeling, rebuilding, so that we can really fill in those fine lines, wrinkles, scarring, whatever it may be. This is going to be kind of your catch-all treatment. Again, a little bit more downtime associated with this one. And then we customize your treatment. So just because we say coring doesn't mean you're only getting coring. We add, like UltraClear and, whatever else to it, we give you a full treatment, however we see fit for your skin.
Yeah, so I just had coring and UltraClear 14 days ago. I'm still healing, but I'm a slow healer. That's normal for me. I'm still really I'm pretty red still, and I have some markings on my face, but I am not worried about it because by week 4, I should be good.
Yeah.
So
she has a tiny bit of makeup on and you can't even tell. So it's cover upable at, definitely this stage, but even by day 3, 4, 5, you can cover up whatever you see. One thing to note with coring is this is where we do have to be more careful with Fitzpatrick's 4, 5, 6. We just kind of tailor it more towards each individual person, but still doable. We just kind of adjust the settings accordingly.
Okay, so as Brittany was talking about the 3 modes, the 3D Miracle obviously is just for the epidermis, the top layer of the skin. The UltraClear is going in the dermis, part of your skin. And then the laser coring is going really deep in the dermis, the hypodermis. So we're getting down there pretty deep.
And that stratum corneum you see top left there, that's just that outermost layer of the epidermis that's sloughing off with that 3D Miracle. Yeah. So that's what we focus on there. All right, so this is just kind of a timeline of lasers in the past. I mean, there's so many lasers out there. You'll hear of, countless ones. There's just a few listed here. Excuse me. So on the far left, you'll see the CO2 laser. This came out in the early 90s. I most often compare the UltraClear to a CO2 laser, just in the results that you get, the effects, whatever, things we're looking to treat, it's going to be the most similar. Now that was over 30 years ago. So you can see that technology, hasn't changed since then. So then fast forward to April of 2022, that's when UltraClear was officially launched. It got FDA approved for fine lines, wrinkles, age spots, scar revision, actinic cheilitis, and skin resurfacing. And then a couple years later, it got FDA approved for benign pigmented lesions and vascular dyschromias, just redness basically of the skin and other like sunspots, whatever it may be. So you can just see, not much change in technology all those years until UltraClear came out and kind of changed the game for ablative lasers. Actually, will you go back for a second? Missy, I don't know if there's anything else you want to add on this one, just maybe dive a little bit deeper into the lasers.
Yeah, I think it's a great job that you did. I think that, when we look at the evolution of the technology in the market, you really hit it on the head. And I think what a lot of questions that we get from patients are, what's different? Like, why is this so different from CO2 or traditional erbium YAG? And the answer is that it's the first fiber laser of its kind that is the most versatile, that we can give the least amount of downtime with the least amount of pain and treat anyone that walks through the door. With traditional CO2 lasers, what is happening is that you're using 60% heat. And so you can't use it on everyone because it can cause things like post-inflammatory hyperpigmentation or hypopigmentation. And it's only 40% ablation. And then even with erbium YAG, they're technologies that have been around for, almost too long. They're a little bit archaic at this point. And a traditional erbium YAG, even though it can give some good results, the downtime with both technologies, meaning CO2 and erbium YAG, is about 2 to 3 weeks compared to 4 to 5 days to a week with UltraClear. So that's the only thing I would sum up.
And something to note too on this slide, you'll see it's available in 64 countries worldwide. So this just shows how widespread it is, how popular it's become. And like Holly touched on earlier, we are the first and only in Nebraska to have this. And so that's a really special thing. And we're just really happy to be a part of it now. Yes. Okay, so here's a little video we will get playing. So this is just showing, let's get it going here a bit. No, you're good. You're good. So this just shows how it's quote unquote like drilled down into your skin. So we see that second layer there, there's your dermis. The blue and red arrows. So the red just signals the thermal energy that's being delivered. The blue is a break, basically. So that's that cool fiber or that cool pulse technology that's being delivered. That's what makes this so comfortable and, you know, less discomfort, less downtime with this laser, because we are controlling that thermal energy. So as the coag you see in that top left goes up, that's more of the redness. So it's causing a more intense treatment, but it's still controlled with that cool pulse energy. And something to note is the technology, it's like micropulse technology. So each of these pulses that you're getting when you get the laser, it's super, super fast. So that's also what makes it so comfortable and the downtime less. And also why we can treat all skin types, just because you can control the heat and the coagulation that we give you.
Okay, it looks like in this video, we have a physician doing, I assume he's doing UltraClear. We do cover up the eyes. We do protect your eyes from any kind of the laser beam. But yeah, it looks like he's going to be performing UltraClear on this gal. And as you can see, she's comfortable. She's not in a lot of pain. It's tolerable. So.
And you'll see, so that thing on the left, they're just sucking out smoke. So that's a smoke evacuator. You'll notice the markings. So when we talk about, you know, like markings sticking around for a couple of weeks or whatever it may be, this is what we're talking about. So you'll see these right away on the skin. They generally fade over even the first day, and then leave you with the redness, but you will see that they go on the skin like this.
But they do disappear.
Yeah, they do. They do. But yes, this is what is giving you the good glow.
So we had a patient come in to us and she talked about how she really wanted to treat her fine lines and wrinkles. She wanted a glow because she just felt dull, and she does a lot of stuff outside, running, hiking, everything. So we said, let's do the UltraClear. So we'll just go ahead and.
Hi, my name is Karen, and I received the UltraClear from Euphoria Health. I wanted to get it because I wanted to help with some fine lines and wrinkles on my face. And, you know, prior to the treatment, I didn't really know what to expect. And when I went in, they did a really great job of making me feel comfortable during the treatment. They did add some numbing cream to my face, and they gave me a fan to hold on to. They also gave me a mechanism, because I was feeling really nervous, to help kind of distract my nervous system, which I really appreciated, and explained to me what they were doing throughout the entire process. After the process, my face turned really red, which felt kind of uncomfortable. They said it was going to feel like a sunburn. However, my face didn't get super hot. It just looked really red, and it did peel and felt pretty itchy for a few days. However, it took about 4 to 6 days, and I did a lot of the vinegar soaks that they provided, which provided a lot of comfort during that time, and I used a lot of lotion on my face during that time. And then I'm really super happy with the results. As you can see, I feel like I've had a glow ever since, and I've had a lot of people tell me that as well. So I definitely look forward to doing it again.
Yeah. And so, yeah, we'll just touch on, I mean, you can see in this before and after her glow on her, like the cheekbone, for example, and just the reduction in some of those deeper lines around her mouth, and just the brightness in her complexion. I mean, she's glowing.
And Karen doesn't have any makeup on, so you can really see her glow.
So I'll touch on now just because she kind of brought it up, but the aftercare. So it's something we really discuss in our consults, is like what to do before and, how to prepare for your appointment, and then the aftercare. So she mentioned the vinegar soaks and, the moisturizer and all of that. So we do provide you with an aftercare kit after one of these treatments. And what we really encourage is just one, keeping your face clean. You just had a lot of micro injuries on your face. So we just want the cleanliness. The vinegar soaks help with that, just a good antibacterial thing to do for your face. But then we recommend Vanicream or Aquaphor even, or something, just a thick, gentle moisturizer to apply as often as you would like, just to keep that skin really hydrated. Because she touched on, the peeling, the itchiness. So all of that can be mitigated with just staying very hydrated. And then
and we're with you all the way. Like you're not just going to come in and we're going to do you and then send you off. We're going to call you every day. We're going to see how you're doing. We're going to see how you're feeling, answer any questions. We follow our patients after the procedure, and we will just check up on them every day and see how they're doing and if they have any questions. So don't think you're gonna come in and you leave and you're gonna be like, oh my gosh, because we will be with you.
A lot of times we tell people, you might not like us for the first few days after, but trust me, trust the process. It'll all work out. It's so worth it. But yes, the healing time is a little rough for a couple of days, but then
and everyone in our staff has had it done, except Brittany, because she's expecting a baby.
But yeah, so that's kind of a quick overview of post-procedure, but we do keep in mind, we do give you stuff to kind of plan ahead as far as the next few days go. So, all right. We are going to touch on or go through some of the before and afters. So first, it's all going to be about that superficial treatment. So these are all going to be the 3D miracles. Most of these before and afters, you'll see it's just one treatment. And so you'll see the difference, and it's amazing what it does. Something to keep in mind is we will always take before pictures when you come and get a treatment done. And then we recommend or really, really want you to come back in a few weeks. We'll stay on you to get an after photo as well. And even after photos like months down the road. Just because they are so important. I feel like you kind of forget what you look like before. And so to see that before and after side by side, you're like, wow, like it's amazing. I really did see a difference. I even saw a gal today who I showed her before and afters from getting her treatment. And she was like, oh my gosh, like she didn't realize how much of a benefit it really made. So that's why we do it. So yes, you'll see in this one, just one treatment, 1 month post. This lady, overall pigmentation, like especially on her cheek, is very minimized. Her brightness all across her face is amazing. I mean,
and that's just one treatment.
Yeah.
So, yeah.
And keep in mind too, the 3D miracle is the one that we do recommend a series. So, I mean, this is after one. So imagine after a series of 3. So pretty impressive. Again, 1 month post, just one treatment. Again, the brightness, some of that pigmentation, some of the redness even in her skin, you can see like forehead, the cheeks, kind of all along, just the improvement there.
Looks good.
Again, 1 month post treatment. You can see the sun damage in that before, and with just a 3D miracle, it's a very impressive reduction all across the board. I mean, her entire face, you see a brightness. And again, 1 month post, one treatment. This one, so 5 weeks post one treatment. So again, this is like a huge improvement with just one 3D miracle. For someone with the deeper lines like this on the neck, I would almost recommend if I just gave her a recommendation, like coring to do right off the bat, just to kind of help with some of those deeper lines. And who knows the circumstances, but she could even go a step further to really try to help some of those lines, but huge improvement with just one 3D
Yeah,
miracle.
just with the 3D miracle. Yeah, for sure.
And then this is, so 1 month post the third treatment. So again, that series, but just that Fitzpatrick 6 showing you that 3D miracle, you know, we can do across the board. And look at her brightness. Her skin is glowy.
It's very glowy.
Glowy. All right, so moving on to more of that moderate treatment. So I'm going to get a little bit more intense with it now. This was actually one of our own. So we did just the eye area on her and with UltraClear. So that combo of pigmentation plus, you know, kind of trying to combat some of those lines around her eye. So that front view, I mean, kind of speaks for itself. You can just see the reduction in those lines. Even just the pigmentation is just evened out tremendously. In that side view, the lines, again, very, very subtle.
And she wants to come back and do her
yeah,
whole face
she's
now.
like, I want to do my whole face. This is, yeah, so I think we're going to get her back soon to do everything. Yeah. This was another one of ours. So this was a keloid scar.
This was treated with one UltraClear treatment, and it was zapped and done. So
yes, so this takes literally 2 seconds. Like it's super, super fast. But just another thing you may not know yet, you can even treat just people with keloid scars, you know, that overgrowth of tissue. Sometimes they get on certain scars and you can treat them. So along with other scars on the body, this is a great tool to use. This is not ours, but this is a treatment with clear, so that pigmentation. And just to note, you know, a little higher Fitzpatrick, say like 4, that's still very, can be done, so. And then if you don't want your whole face, we can just do little spots. So you'll see this spot on her, around her eye after 2 treatments. So 4 months post 2 treatments on that far right, how much improvement was made in that one little area is super impressive. She's probably lived with that for quite a while. So, and then again, this is probably more of a melasma we're looking at. So 10 months post 2 treatments with that clear, so that pigment 1. Melasma is super, super tricky. So typically it's brought on, you know, by pregnancy, hormones, sun, whatever. But you have to be very careful with it. So like certain lasers you can't use just because you can make it worse. So another bonus with UltraClear is we can treat melasma with it. And I mean, look at the difference. It's huge. And I believe that's the same patient just on the other side. So yeah, 10 months post 2 treatments and huge improvement. So again, showcasing, you know, how you don't just have to, we don't just do your face or neck with this. You can do your hands. So the overall improvement with sun damage here. So 5 months post 3 treatments.
I want to do that.
Just the clear. I know that's impressive. After
it's very impressive.
Again, that's, you know, a lifelong just being out in the sun. That's what you get.
Maybe it could be a hand model then.
Yeah. And then this is 5 weeks post 1 treatment. So this is with the Ultra. So we've moved away from the clear. This is more of trying to combat fine lines and wrinkles. So that's what this one worked on. You can see the improvement in her under eye area is greatly improved. So scarring. So we've touched on this, but just the improvement after 2 treatments. That was only 2 months after her second. So, or him. Something to keep in mind with all of this is the collagen rebuilding process. With all of these, what we're doing is rebuilding that collagen, which it's a process. So it takes time for this to all happen. So even after your treatment, you know, you're healed, let's say 2 weeks later, you notice a good improvement. That's great. But the good news is it's still getting better. So for, you know, 6 months to a year after, you're noticing that improvement with the collagen rebuilding. So just something to touch on.
And you have to have patience, but you have to trust the process.
I know it's like one of those things you want to see the result right away, but it does. It will get there. It takes time. So this was a customized treatment. So combining multiple modes, again, the pigmentation, and I mean, probably did like an UltraClear all across the face, really focusing on some of those, the deeper set lines on the jaw, the jowling, and look at the just overall improvement in her jawline.
The texture,
Everything. I mean, the
That's
pigment
good.
on her cheeks and her forehead. So great improvement there. That's just after one treatment too.
Oh, men can do it.
And men, yes. So we always talk about women, but men can do it too. So this was 1 month post one treatment. You'll notice the overall improvement in the eye. Those deeper lines are smoothed out and great.
They look good.
So this was a customized treatment as well.
Yeah.
Probably, again, a combo UltraClear of some sort. And here, customized as well, 1 week post one treatment. So even like acne, the acne scarring in the redness from her acne scarring, just the improvement in that. I mean, this looks like she has makeup on and she doesn't. It's, it looks like a filter and her face is just so clear from it.
Mm-hmm.
Another customized treatment focusing all around her mouth here. And this is another one that, you could discuss with her ahead of time, and like she could be a good coring candidate as well. But this is just what they came up with, and a huge improvement with this alone. So this is 42 days post one treatment to be exact. But in the left, that was bruising. So she has some bruises on her cheek, probably possible filler or something. But just to note that that was not done by the UltraClear laser, but just her overall improvement in the pigment. Yeah. So another great result there.
Ooh,
And this one is so impressive. I mean, she's probably had those acne scars for decades, and the pigment, those bigger sunspots there, I mean, huge improvement. And that's just
one treatment.
One treatment after 3 weeks. And so that is huge. And she could probably get another one and get even more impressive results. So this one is another good one. So this is 1 month post 3 treatments of that UltraClear. Amazing. She could probably do coring right off the bat, maybe even a couple, and get another great result. But this is something you see like surgery wise, like as a neck lift. It's crazy impressive that this is done by a laser. So notice Fitzpatrick 4 here, got UltraClear done, and same thing, those deep ice pick acne scarring that she's probably had forever and they've always bothered her, and huge improvement, just overall smoothness there. So this is another UltraClear one, a combo. So 4 days post 1 treatment and then 7 days post 2 treatments, you'll see there. And just, I mean, she looks like a whole new person by the end of
refreshed,
the second treatment. So
aw.
And kids. So obviously it's not done all that often, but you can do kids. So this little guy had a scar, and I mean, this treatment again probably took 1 minute, super fast, but it can be done and get huge improvement with scarring. So this lady was 5 weeks post 1 treatment. Again, brightness, complexion, pigmentation, just gone. And this one, this is another, like, is this surgery or is this the laser? But yeah, just her jawline. You'll notice that tightness that just is crazy.
And she's a higher Fitzpatrick too.
Yep. So this was UltraClear. And then his face just so smoothed out. 4 months post 3. So this is his 3rd.
He looks tighter too. His face looks more tight.
just sculpted.
Sculpted. That's a good word, Britt.
Yes.
Ooh.
Okay, and then yeah, another incredible one, 3 months post 3 treatments. So just that pigmentation improvement all across the board. Her lines, like, again, looks like she has a filter on. Her under eyes, I mean, everything is just bright, smoothed out. Complexion is glowy and smooth. Okay, so laser coring now. So this is going to be that most intense treatment. We'll show you some before and afters real quick here. First, there's going to be a little animation. So if you want to go to that, Anna. So what is laser coring? So this is just going to be a little animation of what's happening with coring. So you get these kind of like drill points, quote unquote, and this helix pattern that dives down into your skin. So we adjust the depth for each, person, each area of the face to really target what we want to target. So you see it's diving deep into that dermis, and what we're trying to accomplish is that collagen remodeling. So these are some laser coring before and afters. This one is just one treatment. So typically laser coring is going to be a one and done. It is a permanent result. However, aging continues to happen, unfortunately. And so it's one of those things where maintenance down the road may be needed or wanted, whatever. Yeah. But it is, for the most part, a kind of a one and done. We're doing what we want it to do right off the bat. We're causing that permanent collagen rebuild. So this was one of ours. She had coring done on her neck and then UltraClear on her face. So you can just see some of that tightening in that neck and just overall glowy, refreshed look all over her face. This was also one of ours. This was so we just did her neck. This was about 4 weeks post laser coring with an UltraClear on top of that coring. And you can just see, again, the tightness in the neck, reduced some of that heaviness under her jaw, and then some of those lines on her neck are really smoothed out. And she's even going to come back in most likely for a second treatment
because her neck was,
she could benefit from it for sure. This is not ours, but this was another one. Looks like they really focused neck for sure, and then maybe even lower face. 5 months post one treatment, and you can see the tightening of that neck, reduction of those lines, and all of that just greatly reduced. Again, 6 weeks post one treatment, huge improvement on the neck, on that lower face, all of those deeper lines. It's crazy. I mean, again, it's just
it
like,
looks so good.
It's
Like that's
like
one
you
treatment I would think.
take an eraser, one of those.
Well, that's what some of that we were talking about. Like some of them were like, oh my gosh, our own. We're like, we didn't Photoshop them.
Yes.
They look like
you edit, and it looks like it's edited, but it's not. It's just, it's that great. This is the same lady, just that frontal view. So you can see again how her smoothness around her mouth and all of those lines are. Getting some sun. And then again, just a different view of her face and just the reduction in those deeper lines around her mouth. So this under eye, like look at those, like you don't see the lines anymore. With coring around the eyes, I mean, it helps fine lines in the deeper lines, but it also helps some of the puffiness, some of the even hollowing of that under eye. So it's kind of a multi-purpose treatment, and it can almost give like a bleph look. So like the surgery of the upper lid, you can work on that to kind of help lift and open the eye as well. So
yay, good part.
Awesome. So what everybody has come here for today. Thank you guys. That was a fantastic presentation. I cannot wait to get my treatment done. So for everybody that's tuned in live with us today, we have some special bonuses for you. So everybody will receive 10% off of their UltraClear package. And the first 5 of you to book your treatment will actually also receive 20 units of Botox on us. So make sure that you are getting ready to schedule your consultation. I will pop our phone number into the chat here so you can text us very easily. And our team will be in touch with you first thing in the morning so that we can get your consultation booked. This offer is only valid until October 3rd, so you definitely want to jump on it now and be one of those first 5 attendees to also get the 20 units of Botox. So while you guys are texting us, I will go ahead and pull this down and we can go ahead and get into the Q&A, another one of my favorite parts. All right, a couple of questions have already popped into here. So let's see, first question. I know you mentioned a little bit about the after treatment, but what does the aftercare look like and how long will I have to be doing like the vinegar soaks?
So you'll leave here, you'll be a little bit red and possibly bloody. We don't want you to touch your face at all that day. So we will apply, a heavy cream on after. You just let that soak in, you let that do its thing for the night. And then we do not want you to touch it at all. Don't even wash your face. So the following morning, you can wash with a gentle cleanser. So like a Vanna cream, CeraVe, whatever it may be, just something gentle. And then you can kind of, not roughly, but just pat off that kind of excess blood or whatever it may be. And then reapply some of that Vanna cream or thick moisturizer, Aquaphor, whatever. And then, so you'll do those vinegar soaks 3 times a day for about 3 to 5 days. It's kind of up to you. It feels really good. We recommend putting the water in a fridge just so it's nice and cool. It can really soak up all of that goodness. And then, again, just gentle cleanser and moisturizer for the first 3-4 days. At day 3-4, you can apply some like tinted sunscreen or whatever if you wanted to use a light makeup just to kind of cover up whatever residual you have on your face. And then after that, it's, we recommend avoiding any skincare products with like active ingredients for a week or 2, especially like retinols or, whatever you use, just keeping it very simple. But that's kind of the gist of the aftercare. It's very simple.
And like for the 3D Miracle, you don't really need the vinegar soaks. Because we don't even numb you for that. But unless you're Anna. But yeah, so there we just apply a moisturizer. So that one's a little bit more simple.
We give you like I said, we walk through with you day by day. If you have any questions, we give you our cell phone numbers. You can call us any time of the day or night and we'll help you through it.
Let's see. So if I'm ready to book my treatment, are there any patient financing options available?
So we do offer some financing through Cherry, which, we can discuss that on an individual basis. You sign up and you can see, what you're approved for and what your interest rate is and all of that.
Care credit.
Oh, in care credit.
Yeah.
Multiple options. Fantastic. Let's see. How long do I have to stay out of the sun after my treatment?
So we recommend, especially that first 3 to 4 days when, you're not using SPF, staying out of it completely until you do apply the SPF. But even for a good 2 weeks after, we recommend being very, very vigilant with your sunscreen and just being very careful out in the sun. Your skin, it's like baby skin at that point. We want to kind of protect what we just did, and you're investing a lot of money into your skin. So we want you to be as kind of cautionary as possible. But yeah, so about 2 weeks after, just extra careful. And then again, sunscreen after that, very well.
Awesome. Sunscreen's always your best friend.
Yes.
Okay, so I know we saw some other body parts with UltraClear. Is the aftercare treatment for like your hands the same as you would for your face?
Yes. Again, just hydrating, sunscreen, especially if you're going to be out in the sun. Vinegar soaks are not as necessary, as far as like the rest of your face or neck. But as far as just, keeping it hydrated, keeping it moisturized, and just avoiding sun is kind of the biggest things with that. And knowing that it does take,
chemicals or something,
and knowing it just takes more time. So
Right. Is there anything that we can do to expedite the healing, especially if we do laser coring?
yeah, so making sure you stay on top of, all of your aftercare instructions that we tell you. That's kind of the biggest thing, and then staying out of the sun. But as far as like extras go, you could do like red light therapy, can help, just improve circulation, so it can help expedite healing. We do offer PDGF, or like a growth factor serum, and so which is just a super, super concentrated serum of growth factors, and this can also speed up the healing process. So there are options as far as what you can do to keep that, or like stay on top of it and help improve that.
And then after some time, like 4 weeks, like if you do still have like some redness or stuff, we can always come back, because we can always, do the IPL to help with that healing part.
Awesome. That's fantastic. Let's see. One more question here. Can I do UltraClear if I've had a facelift?
Oh,
Yes.
you actually can do it, but you have to wait obviously till you're completely healed. And I probably will get the okay from the plastic surgeon.
Yeah, I would, obviously check with your provider, your surgeon, but again, it's definitely possible. And a lot of people like to do it for like the scarring post surgery. So again, you could do it for that purpose as well, just as long as you are healed after your surgery.
Yeah.
Fantastic. That's amazing. Awesome. Well, I think that looks like all the questions that we have in the Q&A right now. So make sure that everybody attending, that phone number is right in the chat. It's also on our website. While you're checking out the chat, if you want to go ahead and follow us on Instagram, stay up to date with any additional promos that we do down the road. We'll see some more before and afters as we post them. But we can't wait to see everybody in the office for their consultation.
Yes.
So,
Thank you
Brittany,
so
Theresa,
much.
thank you so much. That was absolutely
Bye.
fantastic. Bye, everybody.
Bye-bye.